Hello and welcome. Today we're diving deep into a complex and often misunderstood condition, autoimmune endocarditis. This is a rare disorder where the body's own immune system mistakenly attacks the inner lining of the heart, known as the endocardium. Join us as we unravel its mysteries, exploring its causes, symptoms, and what can be done to manage it. The exact cause of autoimmune endocarditis remains elusive, making it a challenging condition to understand. Unlike infectious endocarditis, which is caused by bacteria or other pathogens, autoimmune endocarditis arises from a malfunction in the immune system. This can be triggered by various factors. Systemic autoimmune diseases like lupus or rheumatoid arthritis can sometimes lead to secondary autoimmune attacks on the heart. Genetic predisposition may also play a role, making some individuals more susceptible than others. In some cases, certain medications or environmental factors might act as triggers, initiating the autoimmune response. The bottom line is, autoimmune endocarditis isn't caused by an infection, but by the body mistakenly attacking itself. Let's break down how autoimmune endocarditis actually affects the heart. Normally, the immune system protects us from foreign invaders. In autoimmune endocarditis, this system goes haywire. Immune cells, like T cells and B cells, mistakenly identify the endocardium as a threat. They release antibodies that attack the heart tissue, causing inflammation and damage. This inflammation can lead to thickening and scarring of the heart valves. These damaged valves may not open or close properly, disrupting normal blood flow. In severe cases, this can result in heart failure, arrhythmias, or even life-threatening complications. The precise mechanisms driving this autoimmune attack are still being investigated, but the consequences for the heart are significant. Due to its complex nature and difficulty in diagnosis, the exact prevalence of autoimmune endocarditis is not well established. It's considered a rare condition, often occurring as a complication of other underlying autoimmune diseases. Because it can be underdiagnosed or misdiagnosed, pinpointing the true number of affected individuals is difficult. Researchers are working to improve diagnostic criteria and awareness of the condition, which should help to clarify its true prevalence in the future. The symptoms of autoimmune endocarditis can be varied and often mimic those of other heart conditions, making diagnosis challenging. Some common signs include fatigue and weakness, which can be persistent and unexplained. Shortness of breath, especially during physical activity or when lying down, is another frequent symptom. Chest pain or discomfort may also occur, which can be sharp or dull. You might also experience heart palpitations, feeling like your heart is racing or skipping beats. Other symptoms can include fever, night sweats, and unexplained weight loss. It's important to remember that these symptoms can also be associated with other conditions, so it's crucial to consult a doctor for proper evaluation. Diagnosing autoimmune endocarditis can be tricky, as its symptoms often overlap with other heart conditions. The diagnostic process typically begins with a thorough physical exam and review of your medical history, especially any history of autoimmune disorders. Blood tests are essential to look for markers of inflammation and autoimmune activity, such as elevated erythrocyte sedimentation rate (ESR) and C-reactive protein (CPR). An echocardiogram, an ultrasound of the heart, is crucial to visualize the heart valves and chambers, looking for signs of damage or dysfunction. An electrocardiogram's ECG can help detect any abnormal heart rhythms. In some cases, a cardiac MRI or even a heart biopsy may be necessary to confirm the diagnosis and rule out other possible causes. Autoimmune endocarditis doesn't typically have distinct classifications or types in the same way that infectious endocarditis does. Instead, it's usually categorized based on the underlying autoimmune disease it's associated with, such as lupus-related endocarditis or rheumatoid arthritis-related endocarditis. The severity of the endocarditis can also vary, ranging from mild inflammation to severe valve damage and heart failure. Understanding the specific autoimmune disease driving the endocarditis is critical for guiding treatment strategies. Managing autoimmune endocarditis focuses on reducing inflammation, controlling the underlying autoimmune disease, and supporting heart function. Immunosuppressant medications, such as corticosteroids and other disease-modifying anti-rheumatic drugs, DMRDs, are often used to suppress the immune system and reduce inflammation in the heart. Treatment for the underlying autoimmune disorder is also crucial. In cases of severe valve damage, surgery may be necessary to repair or replace the affected valves. Medications to manage heart failure, such as diuretics and ACE inhibitors, may also be prescribed to improve heart function and reduce symptoms. Regular monitoring and follow-up with a cardiologist are essential to track the effectiveness of treatment and adjust as needed. Unfortunately, there are no specific strategies to directly prevent autoimmune endocarditis, as it arises from complex interactions within the immune system. However, managing underlying autoimmune diseases effectively is crucial. If you have an autoimmune condition, work closely with your healthcare provider to control your symptoms and prevent complications. Regular check-ups and monitoring for any signs of heart problems are also essential. Maintaining a healthy lifestyle, including a balanced diet, regular exercise, and avoiding smoking, can help support overall heart health. The prognosis for autoimmune endocarditis varies greatly depending on the severity of the condition, the underlying autoimmune disease, and the promptness and effectiveness of treatment. Early diagnosis and aggressive management can help improve outcomes and prevent serious complications. However, in some cases, autoimmune endocarditis can lead to significant heart damage and even death. Researchers are actively investigating new therapies to better target the immune system and prevent damage to the heart. Recent advances in understanding the specific immune pathways involved in autoimmune endocarditis may lead to more targeted and effective treatments in the future. Clinical trials are also exploring the potential of new immunosuppressant drugs and other innovative approaches to improve outcomes for patients with this challenging condition.